RSV you might hear mention, and it's just one of those winter viruses. We tend to see it during the winter, maybe October, November we'll get a run of it, and then again February, March are particularly the peak times. And it's just one of many viruses that children get. Can cause particular problems for the small babies, and you might hear your doctor or your pharmacist mention bronchiolitis, and that's when the virus just gets into a small baby's lungs and makes them breathe a little faster, they're a little bit more tired than usual, and they're not feeding as well. Now, we've no cure for a virus, so all we need to do is make sure that your baby is getting enough oxygen and enough fluid, and that they're not struggling in that way. So what I would say is have a look at your baby. If you can get a small bit of fluid into them, probably half of what they normally take, I'd be happy with a baby at home if they can take half of what they normally take. But if you have a baby who normally takes 6 ounces or 120 mils and they're taking less than half of that, then you probably need to go and see your doctor or your out-of-hours doctor, or come into us in one of the emergency departments. Fluid and oxygen are important. So most babies are fine in air, and you'll know that they need oxygen if they're struggling with their breathing. So if their chest is moving in and out, and if they're using those muscles to breathe is making them tired, and they're not able to smile at you, and they're not interacting with you the same way they normally do, I would say with a small baby, that's when you should get them checked out. If you come into hospital, sometimes all we do is just mind them, give them a little bit of oxygen to help their breathing. Sometimes we give them a little fluid or a little tube into the nose with some milk in it, and we just help them get through that infection. I think RSV is tricky because it can last a little bit longer than some other viruses. So it tends to be there, getting worse and worse for the first kind of 3 or 4 days. It then just stays the same, and that's the stage when most parents will come into us and say, look, my baby just isn't getting better, and that's true. It seems like they're not getting better. And then for the next 3-4 days is when they get better. But that cough can be there, so you're talking about a good kind of 2.5 weeks for that RSV really to pass.